Hi, Robert Lederman here, and today we're going to be looking at saccades. Now, just to get something clear about saccades, what we're actually doing when we make a saccade is we're transferring our window of attention from place to place, something we do when we move our eyes from item to item, from word to word, from letter to letter, digit to digit. Something all our patients are doing all the time, transferring their window of attention through manipulation of their oculomotor system. And I'm sure you understand that how well they do that, how well they have oculomotor control, how smooth and accurate the movements are, is going to have an effect on their ability, on our ability to gather information accurately and rapidly. One of the tests which I like to use among a number of different tests is of course the Developmental Eye Movement test, which I have here. And we're going to be looking at a child who's performing test C on the Developmental Eye Movement test, which is a test in which we need to move our eyes from number to number as we move across the line, and then the next line, the next line, the next line. And when you do the Developmental Eye Movement test, what's interesting to note is how the patient actually goes about performing it. So let's not waste any time and get straight to it. We'll have a look at this young person carrying out test C of the Developmental Eye Movement test.
5,
And what we see,
4,
we can ask ourselves, is he moving his
2,
eyes? Is he moving his
9,
head?
3, 9.
Well, he actually seems to be moving more than any other part of his body is actually his arms. So he's actually moving the test
7,
beneath his
4,
scanning system, which are of course his eyeballs, and that is how he is gathering the information.
7.
Now, if you imagine the eyeballs only weigh 9 grams, that's a lot of extra
8,
effort and energy he is
9,
using to gather the information
5,
on that
7,
page.
3.
So, you might have had a child like that in your chair today. A child may be sitting in remedial classes. Carrying out the Developmental Eye Movement test in this way, where you allow the patient to hold the chart, can reveal more information, as we've done here. If that chart had been on the table, then I would have noticed other things. I would have noticed head movement, perhaps, but I wouldn't have seen the degree to which this young person is struggling to move his eyeballs. And of course, it could be based in a developmental oculomotor dysfunction. You know, there's functional oculomotor dysfunction and developmental oculomotor dysfunction, and sometimes you have to go further back into retained primitive reflexes, bilateral integration, general motor development to understand the real story behind the story. But the point we're getting at over here is by doing these tests, we really get more information about our patients, perhaps how they're struggling, and most importantly, how we can go about helping them. If you'd like to stay more in touch, hop on over to robertlederman.com, sign up for my newsletter, and we can stay in touch and you won't miss out. All the best.